9 o'clock, so I would just like to welcome everybody to the fourth webinar series, which is part of the book launch series, looking at the book Productivity and Pandemic, the Challenges and Insights from COVID. I'm Kirsty Newsom from the University of Sheffield, so I'll be chairing the session, and this seminar is looking at the incredibly important issue of employer and employee needs post-COVID-19. We have a wonderful panel of 3 speakers. We've got Professor Colin Lindsay from the Department of Work, Employment and Organisation at the University of Strathclyde. Colin also is playing a lead role in the ESRC-funded Propel Hub and has projects within that hub. So welcome, Colin. It's very lovely to see you. Our next speaker is Daniel Papaska. I hope I'm pronouncing your surname. Daniel is a research fellow in at the Health Economics Research Unit at the University of Aberdeen. His research focuses on the intersection between health and labour economics, with a particular focus on how to protect mental health and maintain productivity or boost productivity. So Daniel, welcome, very lovely to meet you and see you. And finally, we've got Professor Anne Green, who's Professor of Regional and Economic Development at the University of Birmingham, and has got a long-standing interest in regional and local labour market issues and issues around regional development, has been funded through the SRC initiatives on productivity, quite a lot of initiatives on the SRC and productivity, not least of which is the current one that she's looking at as also part of the Propel Hub as well on productivity from below, the challenges of micro businesses. So welcome everybody, really glad you could join us. The way that we're going to organise the session is that the speakers are going to talk for about 10-15 minutes. I've probably given you 5 minutes extra time than you thought you were going to have. And then we'll go to questions. The questions can be in the Q&A, which is in the bar at the bottom of your screen. So just before we pass over to Colin, I think we've got another slide that shows that this webinar is obviously part of the Productivity Insights Network, which was established in January 2018 in a previous world, and of course the Productivity Insight Network is a multidisciplinary network of social science researchers attempting to change and focusing on changing the tone of the debate about productivity and trying to find solutions to the productivity gap in the UK. So welcome everybody. I'm going to hand over to Colin.
Okay, thanks so much, Kirsty. I'm afraid, colleagues, there's no PowerPoint. I thought I'd spare you PowerPoint on a Friday morning. Delighted to be here. Thanks so much to the Productivity Insights Network for organising this webinar. Our chapter and my brief remarks today really just try to scope out some of the key issues that are covered and connected to some of the ESRC investments that we are working on right now. As Kirsty was saying, I'm part of a project on improving management practices, work engagement and workplace innovation that is funded by the ESRC. So I'm going to draw on some ideas from there. I have the pleasure of leading a project called Productivity Outcomes and Workplace Practice Engagement and Learning, the Propel Hub. And I'm also going to pull a couple of ideas from a project that we just completed for the Productivity Insight Network on drivers and productivity impacts of underemployment. Thanks again to PIN for all their support with that project. So what I thought I'd say today, and basically the story of the chapter that we have in the book, is I guess the starting point is to say that employers, sectors, regional economies face an enormous challenge in terms of building back from COVID, in terms of massive shifts in consumer demand, massive shifts in sectoral configuration, shifts in economic geography, and crucially shifts in business model. And we argue in this chapter, and a big part of our research, is to say that people, employees, can be and should be a crucial part of the solution in helping businesses and economies to bounce back, to build back post-COVID. And really the focus of our research is to try and work out and explore what kind of HR practices, what kind of workplace and organizational structures, and crucially, spoiler alert, crucially for today's talk, what kind of jobs, what kind of job design factors are the kind of investments that employers and economies can make that will improve people's job quality and also empower employees to be part of the build back journey, to empower employees to help businesses to innovate and be agile and build back post-COVID. So that's really the focus of my talk today. It's also the focus of those 3 projects that I just talked about. Those projects are essentially about the idea that we can intervene in the workplace, and those kind of interventions can have what we might call mutual gains for employers and employees. There are workplace practices, HR practices, ways of designing jobs that have benefits for employees in terms of well-being and job quality, and can also, crucially, drive innovation within organizations and sectors. So that's really the ground that we're trying to explore in our chapter. The other thing, the point that I want to acknowledge, and is well acknowledged in the chapter, is of course that these kind of investments and these kind of strategies are shaped and constrained by business models. So we're not naive enough to think that every employer and every segment of every sector is going to immediately reinvest in higher job quality and in what we would call workplace innovation. Business models constrain and shape decision-making within organizations. But I guess the point of the chapter is to say many of the dominant business models in regional economies in the UK have been thrown into considerable flux. So the points that I just made about massive shifts in consumer demand, massive shifts in the organization and work design that employers use to deliver value. So I guess the argument here is perhaps there's an opportunity here. Perhaps there's a space, given the substantial challenges that employers face in trying to be resilient and to build back after COVID, and given the fact that existing business models have been thrown into such flux, maybe there's a space here to engage with employers and other stakeholders, crucially, to rethink how we do HR, how we do workplace design, how we do job design in a way that is going to drive improved job quality, improved employee well-being, and improved innovation performance. So those are really the 3 points that I want to make and the 3 literatures that I want to draw on in today's talk. Yeah, I mean, again, I'm going to start and end with business models. And of course, our research in our chapter acknowledges the fact that business models shape the decision-making processes and the investments that happen within organizations and within sectors. And clearly, one of the reasons that the SRC invests in things like PIN and invests in the kind of work that we do is that there's a problem here in the United Kingdom in terms of the predominance of business models that perhaps are in many sectors that perhaps are focused on maximizing short-term shareholder return, are focused on maximizing flexibility on the side of the employer, are focused on cost minimization, are focused on the financialization of the HR process, and have little stakeholder voice or stakeholder orientation beyond the demand to return value as much and as quickly to shareholders rather than other stakeholders, of whom employees might be a crucial component. So we acknowledge those major challenges of trying to think about improving job quality and improving innovation performance within business models that constrain that. And the other thing to remember here is that we all pay for the costs that are exported by poor business models. So poor job quality has negative impacts for regional economies, for people, for communities, the health system, the welfare system. You and I as taxpayers have to pick up those costs. So business models constrain our ability to deliver good job quality and to deliver the kind of innovation we need to build back post-COVID. And the negative, poor business models create additional costs that constrain us from doing lots of other positive things. So, as I was saying, business models, big framing device and a big challenge for us in terms of framing these discussions. However, what we might argue is that even within sectors, even within segments of sectors, there is variation in the business models and workplace practices that are selected by employers. That means to us that trying to produce evidence on what might work in improving job quality and innovation performance is a worthwhile endeavour. And I go back to the point that maybe this is a great time to have that discussion, because extant business models and assumptions of how business create value have been thrown into tremendous flux by COVID. So businesses, policy stakeholders, all of us are grappling with the issue of how we try to deliver employee well-being while also trying to include employees in the journey towards building back and more innovative and agile businesses. So we think intervention in the workplace might be one important component of the answer to that. So, my goodness, that was a preamble and I've already taken up most of my time. Let me suggest 3 areas of workplace practice that we are interested in and that come up in our research that might be relevant here. So I want to talk about HR practices, I want to talk about workplace and organizational design, and then, as I was saying, spoiler alert, the thing that my team is particularly interested in is job design and job quality and how that can support employee well-being and employee innovation. So first, I'm a professor of HR. That's what I do in my day job, teaching people about HR. So what does HR literature and HR research say about our capacity to intervene in workplaces to support people to be innovative and to drive productivity within organizations? Well, as you'll know, it says lots of different things, but I want to draw a couple of evidence bases. The kind of work that's done by people like Anna Bosnillis and colleagues in the Netherlands and Helen Shipton and colleagues here in the UK. 2 things that come to me from that research base are, one, the HR capacity matters, that actually investing in people management expertise, systems capacity is beneficial for organizations, for their people, and for their ability to innovate. So I don't buy, I'm afraid, the line of argument from the billionaire business owner who was in the news this week, who said, I run a £1 billion company and I don't need an HR department. And I think if you actually read that article or looked at those news stories, what you actually found was that his company has invested heavily in people management strategies. They just don't happen to brand it as HR, which is absolutely fine by me. I mean, I don't care if people call it HR or anything else. But I think the thing that comes from, for instance, Helen Shipton's work is that investing in people management creates a framework within which we can improve job quality and improve innovation performance. I think the other big takeaway from that HR research, especially Helen Shipton's work, is the idea of experiential learning. So there's been a lot of research about what kind of things might improve innovation performance amongst employees, but one of the recurring themes seems to be the idea that if we can create spaces for people to learn away from their day-to-day job, to connect with other employees within the business, to scan and think about and action stuff that is connected to their job and how they contribute value to the business, but is not directly related to their day-to-day work, that seems to be a particularly valuable investment in terms of supporting people to innovate. Okay, very quickly, that's HR done, tick. So we can think about what kind of HR investments might support people to innovate and to have better job quality. A big chunk of work we've done over the last couple of years is around the agenda of workplace innovation. You might call it kind of organizational development to support innovation. So what kind of investments over the last couple of years have we identified that employers have made that support people to innovate in businesses? I think, again, I'll give you 3 quick takeaways from the 50 or so businesses that I've worked with over the last few years. One, that organizational design that facilitates cross-fertilization of ideas and rotation across teams, collaboration across teams, rather than having heavily segmented and fragmented businesses, seems to be an important driver of innovation and innovative performance amongst employees. Employees having sufficient knowledge and understanding of how the business actually functions and how different components of the business function and how they contribute to the value it's created by the business seems to be very important. Absolutely crucially, for a lot of the businesses that we work with, the most innovative businesses, the whole idea of a culture of encouraging trial and error. So we often talk about, when we present our research, that the best and most innovative businesses have get out of jail free cards, that basically employees know that within a bounded space, they have the capacity to try stuff that might fail. Of course, we have to be careful about how people make investments and how people deliver in the workplace, but those kind of broader workplace strategies beyond basic HRM might be valuable in supporting innovation. And then lastly, you'll be glad to know, our current research is focused more on job design, and particularly on the kind of job design that would support people to innovate in the business, and as a key mediating factor, support people to be engaged in the business. Now, I can already feel people's eyes rolling, because employee engagement as a concept gets a bit of a bad rep in a lot of the academic literature and some of the business literature. And I think there's good reasons for that. I think, there's sort of There's a lot of dodgy employee engagement work that goes on out there. There's a lot of consultants in the field using dodgy tools. There's a lot of rather ropey surveys that are used, things like the Gallup 12 survey, where if you've ever read the Gallup 12, very famous employee engagement survey, they're all interesting questions, but kind of random collection of questions that are kind of piled together. Questions like, do you have a special friend at work? Which my answer would be, yeah, but she left because of Brexit. Which, anyway, let's leave aside my pains at work and get back to the point. So there's a lot of ropey stuff that's done around employee engagement, but I think our current project and what we're arguing in this chapter is that there's actually some pretty robust evidence that says if employers and organizations invest in what we might call work engagement, which is a very robustly understood concept in the psychology literature, there seems to be a relationship between those kind of investments that drive work engagement and people's well-being in the workplace and people's capacity to innovate in the workplace. There's a very recent CIPD, Chartered Institute for Personal Development, evidence review, came out a couple of weeks ago, that makes exactly the same point, that there's a lot of ropey stuff on employee engagement, but a very large evidence base on work engagement, which is basically saying, what are the kind of job design factors, the job resources, as we might say, that elicit positive, effective motivational states amongst employees? So what are the kind of jobs that elicit positive feelings in terms of feeling invigorated, feeling that your work has meaning, feeling dedicated to your work, and feeling absorbed in your work? So like the day goes by, very much like my own job, where very often at the end of the day, I've had so many interesting things to do, like this webinar, that the day's just gone. The argument of that literature, and one that's an argument that our own research is heavily rooted in right now, is that if we can make investments in job resources and enriched job design, we're more likely to elicit those feelings of engagement amongst employees. And there is an argument, a very strong evidence base, that higher levels of engagement support higher levels of well-being. And there's something of an evidence base that says higher levels of engagement coming from these job enrichment strategies promote employees' innovative behaviours. I say there's something of an evidence base because a big chunk of our work right now is to try and build on that evidence base and to try and work out in what context do investments in job enrichment and better jobs, job quality, lead to more engaged employees, better well-being, and better innovation performance. So that's really the end of our chapter, you'll be glad to know. So our argument here is that there's a big challenge for regional economies, for employers, for organisations, for employees themselves. Probably the two biggest things that are on HR directors and organisations in tray right now are, how do we support employee well-being as we build back, and how the hell do we stay in business in terms of providing innovative solutions to navigate these dramatically changing waters around shifting business models, shifting customer needs, and shifting local economies. Our argument is that a big chunk of the answer is about what happens in the workplace and the decisions that employers make around HR strategy, around OD, organizational design strategy, and around, crucially, job enrichment. And our suggestion would be, there's a great moment here to constructively challenge employers and policymakers and stakeholders and researchers to think about the kind of investments that we might be able to persuade employers and sectoral stakeholders to make to enrich people's experiences in the workplace, deliver better job quality, what we here in Scotland would call fair work, and produce more engaged, more healthy, and hopefully more innovative and productive employees, supporting a build back agenda in the UK's regions and organisations. Thanks for letting me go long.
Colin, thank you very, very much indeed. Do love the idea of a positive motivational state. That is a great way to think of the working day. So I'm going to pass over now to, we'll take questions at the end. So I'm going to pass over to Daniel.
Thank you. Can I have the next slide, please? So my chapter reviews evidence around which stressors are impacting on employee mental health at this time due to the COVID pandemic. And then, having identified those particular stressors, reviewing the evidence base for how interventions at the firm or the government level can address, reduce the impact of this stressor. And in doing that, what I find is that many of the issues relate to commitments that were previously made by the government within the Good Work Plan. And I then go on to discuss how meeting those commitments may have positive benefits for both population mental health and also for labour productivity. The next slide, please. So if you think about mental health in economic terms, it is one of the inputs into the production function of firms. And the quality of this input varies along a continuum where at one end you have good mental health, where employees are able to fully utilise their skills and work productively within the workplace. And then at the other end, you have severe mental illness, where employees have a lot more difficulty making that contribution, both within their community and within that workplace. And we know from the Stevenson Farmer Review that there are substantial economic costs to employers of employees suffering from mental health that may not be clinically significant issues, but just any sort of decline on that continuum of mental health. And the estimate of the cost of these issues within the Stevenson Farmer Review is 2% of GDP. And that is just the cost to employers. This is before thinking about the societal costs relating to the care that's required for mental health. So a lot of the costs that from mental health that are absorbed by employers relate to employees continuing to attend work despite having some mental health issue that could be of varying severity. Now, unfortunately, due to the COVID-19 pandemic, the quality of this factor of production, the mental health of the workforce, has declined. There's consistent evidence of both a population level decline in mental health and more severe declines within specific groups, such as younger adults, females, and those of lower income. The next slide, please. So in terms of identifying the sources of the mental health issues within the workforce at the moment, there's been a very good study, a tracker study that's been run by UCL since the first lockdown. And that's what's displayed on this graph here. And they've looked at 4 of the main stressors impacting on mental health at this time. So the top line, the sort of pinkish one, that is concerns about catching COVID itself. Then the blue line underneath, this is concerns about finances. The purple line, concerns about unemployment. And then the turquoise line at the bottom, concerns about getting food. And the dotted lines, the dotted vertical lines, are all different changes in policies around lockdowns, etc., that have occurred during that time. And what's clear from this graph is that the major issue, other than the fear of catching COVID itself, relates to fears of adverse economic events. And it's this economic insecurity that can be targeted by meeting good work commitments and also employer firm-specific interventions. The next slide, please. So when reviewing the evidence base for how you can reduce economic insecurity, there's a few sort of main factors here. And first of all, it's can you reduce the likelihood of job loss? And then also reducing the extent of unemployment, so that how long the period of unemployment would be if there was to be some employment volatility, and then also reducing the likelihood of income volatility. So here I've managed to identify 4 main points, and these relate to issues of employability, careers, ensuring there's a social safety net, and ensuring that there's stability of hours and earnings. And for each of these points, there is evidence within the academic literature that these either reduce mental health directly or reduce insecurity, which would imply a reduction in mental health issues, or reducing the risk of unemployment. Next slide, please. And of course, many of those issues have been raised previously by either the Taylor Review of Modern Working Practices or the UK government's response to the Taylor Review within the Good Work Plan. And by meeting those commitments now, because of the challenges that exist with both the mental health of the workforce and also the economic challenges, the potential of effective policies now has never been greater, because this could lead to both a recovery in health and also an economic recovery. But it's crucial that that it's not just the quantity of work that is targeted with any interventions. The quality of work will matter. And the effectiveness of any policies, it won't just have short-term impacts. There's a very good amount of evidence that shows that mental health within parents, particularly maternal mental health, influences the health and education outcomes of children. So the policies made today will influence the productive capacity of the future economy also. Next slide, please. So in terms of the government interventions that we know something about so far, within each of these points, employability, careers, the social safety net and hours, there is some there is something happening for each of them, although there's a great deal of uncertainty at this time. We've had the national retraining scheme has been absorbed into new policies, which we know less detail about. Regarding careers, the Department of Work and Pension has an in-work progression commission whose consultation just ended in December last year. So we wait to hear what comes out from that. Regarding the safety net, one of the great successes, I would say, of the government's response to the economic challenges of the pandemic has been the coronavirus job retention scheme. It'll be interesting to see a detailed evaluation of that over time, and I would hope that this would also take into account the impact on mental health. And I know that NatSen have been doing some research looking at the relationship between the furlough scheme and mental health, and it appears from their early results that it does have some buffering effect. It does protect the mental health of some employees that are furloughed. But what is going to replace the job retention scheme at the end? And within the chapter, I argue that although a universal job retention scheme is obviously far too expensive, targeted schemes in the long term could be useful. And these could be sector specific or they could be area specific, and they provide a far greater safety net, which will reduce economic insecurity and protect mental health. And then in terms of hours, this is, we really don't know what's happening here. There was a consultation on one-sided flexibility that the Low Pay Commission contributed to. We've yet to hear the outcome of that, despite it finishing quite some time ago. And then, of course, the employment bill, we don't know what's happening with that at the moment. But if there were effective government interventions within that, it could really impact on the productivity and mental health effects of the COVID pandemic. Next slide, please. But of course, it's not necessary for employers to wait for the government to legislate. If the management and employment practices of firms were consistent with the many workplace mental health policies that are in place, then this would also likely lead to productivity benefits and improvements in mental health within the workforce. So two examples of voluntary interventions would be the living wage commitment and the living hours commitment, which would both address levels of economic insecurity. And then also in terms of addressing mental health through management practices, NICE have a very comprehensive review of the evidence within one of their guidelines that is available. And so if employers were to voluntarily make interventions to improve the mental health of their workforce, it is likely that they could gain a competitive advantage through doing this. And at the moment, because of the challenges that we have within the workforce and within the economy, the potential benefits of doing so have never been greater. Thank you.
Daniel, thank you very, very much indeed. And I'm now going to pass over to Anne.
Thank you very much. As you can see, I'm going to talk something about the issues concerning skills development and the skills system. Issues that have been there beforehand, but have been brought into sharp relief by the COVID crisis. So if we move to the next slide, please. Just start off with some of the headlines. And I think most obviously, the COVID-19 pandemic and what we've seen there, we can think of that as a stress test for the skills system. And it's been a stress test that's happened kind of quite quickly and had quite a big impact. We've very much seen the issue foremost, perhaps, about the disruption to young people and work-based learning, the impacts on school children, on students in FE and HE, and also on apprenticeships, and the issue about people who have part of their training alongside employment, work-based learning being hard hit in many cases. I think it's worthwhile highlighting that keeping schools open has been a priority at times of crisis historically. So that whether be in times of war, in times of natural disasters, keeping schools open has always been a priority. And I think that's particularly important given the evidence that we have over many years about the importance of good transitions from education through into employment, and also the scarring effects of people who perhaps don't have such a good educational experience and experience difficulties transitioning into the labour market at the start of their workforce careers. So the issue of work-based learning being disrupted is very important. Clearly, we're hearing an enormous amount just now in very recent weeks about the costs of learning loss. And we know that estimates have suggested that many children across the UK will have lost about 6 months of face-to-face schooling in the last year. And estimates suggest that that might amount to about 40,000 loss of earnings over people's lifetimes. So it can have quite a big impact then. And I think a lot of what we've hearing about also is coming out the other side, the investment in skills being important for economic recovery, the need for a resilient skills system to be able to cope with the different demands faced upon it, the different quantities of people requiring different things at different times. And then very obviously, in the context of longer working lives, etc., the whole issues of the importance of lifelong learning. So if we go to the next slide, please. I want to here focus on some of the challenges and some of the opportunities that the COVID pandemic has brought about over the last year as it is now. I think we've had very much the challenge, if you like, of moving online. I think what we've seen is what can and cannot be done so effectively. And I think an enormous amount probably has been achieved here. But I think we've also learned that there are some things that do very much benefit from face-to-face interactions, particularly if we look at skills surveys, etc., what employers are saying they require. They place a lot of emphasis on what's termed social and emotional skills or soft skills. And they're very much best perhaps developed face-to-face, in person. And that's important also for thinking about innovation, collaboration, and all of those sorts of issues. I think one of the very key things we've seen is about existing inequalities widening. That in turn has implications for social mobility going forward. So in terms of the whole issue of the pandemic, that I think is a very big issue that has become paramount across a whole range of policy domains, and particularly in the skills and education domain. We've seen, as I say, reopening educational establishments and the issue of addressing learning loss, and quite how to do that is a subject of much debate currently. In terms of the opportunities that we've seen, I think we have seen what can be done. I think they're going forward. We've seen the opportunities for online learning, for blended learning opportunities in particular, and perhaps making skills development and courses more accessible to more people because of online learning. I think where the evidence base is somewhat less developed, but there's an opportunity to certainly find out a great deal more, is about what works for whom in new developments in teaching and learning. Who does online learning work best for, when and how? And I think in terms of opportunities going forward, etc., we've also seen the opportunities for innovation in terms of a burgeoning edtech industry, perhaps. So that's something that we perhaps see even more as years go ahead. And there's, I think, opportunities to learn what happens internationally in that regard as well. So if you move to the next slide, please. Just want to highlight, think about the pandemic, which is obviously about a year now, in terms of what we know about changing skills requirements more generally, because I think that's an important issue to keep in mind. And I think in the UK, we have seen over a period of several years, declining investment in skills development. That comes across through many skills surveys, but I think increasingly, we might need to turn attention to how skills are measured in terms of when people are self-reporting investment in skills. What are they actually thinking about? Are they thinking about formal enrolment on courses? Or are they also including within that perhaps some issues that they might engage in online with other people, what they're doing with colleagues, etc. So I think we have seen this declining investment in skills. It's something we need to turn our attention to increasingly. We have in the UK seen vis-a-vis many other countries a tendency for employers to turn to recruitment rather than necessarily training people that are available or could be available, whether they be amongst the unemployed or the economically inactive. I think that's going to be an issue increasingly going forward about how we deal with that as more people become unemployed, and also in the new post-Brexit immigration regime, we might see therefore more emphasis on training and bringing in people outside of employment and what skills they need to be able to be productive workers. I think if we also look at the literature on what sorts of skills we're going to require more in future, I've highlighted here some of the key things. Interpersonal skills, very much there. Interpersonal skills needed for collaboration, higher order cognitive skills. These are the sorts of things that we see emerging as being increasingly important going forward. And a study by McKinsey suggesting that in 2030, what they feel is going to be particularly important in terms of the skill shortages isn't necessarily about specific qualifications, but more generally, digital skills, obviously, STEM skills, and again, these social and emotional, the soft skills. And here finally, I think in terms of changing skills requirements, I want to highlight the role of managers in this. And I think that's something that's been particularly brought to the fore as well during the pandemic, the role of managers and line managers in people's well-being, and also in terms of providing and making available opportunities for training and skills development amongst their own staff. So if we move to the next slide, please. I want to highlight here some of the issues about the sorts of policy interventions that might be appropriate. Clearly, we've got education and training. Particularly, we're hearing very much more about now reskilling for adults, as some people are in shutdown sectors looking elsewhere. The issue of lifelong learning, obviously, and very much in the pandemic, the whole issue of digital skills. And digital skills sort of across the board, digital skills being something that you have to keep topping up to keep up with developments. It's not like learning to read, and hopefully most people, once they learn to read, can carry on. Digital skills is something we have to keep topping up. But I think what's come out of the pandemic in particular is how some people haven't been really engaging with digital skills and have necessarily to do so now. In the outlining remarks, Kirsty mentioned a project, ESRC funded project on productivity from below. I'm involved in, and that's also colleagues at Aston. And one of the sectors we're looking at there is the Bangladeshi catering sector, obviously very hard hit during the pandemic, the closure of hospitality. And businesses there saying, small businesses, they can't afford to open, but they can't afford to close either. And very informal working practices. Some of them not really ever engaged in any sort of digital developments at all, really, prior to the pandemic. But an initiative in Birmingham, what we're doing is getting students involved in providing an introduction to social media skills to at least begin to get some of these businesses online. So in terms of digital skills, a whole range of things that can be done, but that's just one example. I think in terms of employment interventions, we've seen a whole range of things in the past, like work experience, wage subsidies, targeted job retention and creation programs, and also in particular with the emphasis on young people, how skills need to be part of a broader integrated offer. And then in particular, I think in recent times and over the last year, we've seen an emphasis on sort of matching interventions, whether they be the sorts of interventions that help people move from low to high demand sectors, say from hospitality, some of the customer care issues, through to helping them transition into the health sector, where providing support to patients in hospitals, for people visiting people in hospitals, etc. We've also seen an emphasis on how initiatives to try and redeploy people into related sectors, particularly I think in some of the manufacturing sectors where we've seen that, and try and not lose some of the skills that are important in the economy, in supply chains, etc. And then I think also thinking about the longer term of the whole issue of trying, and I think this is important going forward, trying to get people into a good quality job at the outset of their working lives, a job with prospects for career progression rather than just any job. And I think some of the initiatives that we can see internationally, like the Work Advance initiative in the US, where there's a big emphasis on pre-employment services, occupational skills training, sector-specific job development, post-employment support and advancement support. The issue there of trying to get people as they either start their labour market careers or shift to a new sector, to try and get them on a pathway there to career development. If we move to the next slide, please. Just want to finish here with the whole issue of the importance of a resilient skills system. What we need to be doing is obviously understand future skills as best we can. And I think it's important here to highlight some of the things we know and we knew before the pandemic, but they're very important going forward as we try to build a resilient skills system. It does need sufficient and sustained funding. That's very important. We also know about having capacity and expertise, and particularly to plan ahead. That is particularly important as well. I think we've also learned something, and it's been reinforced in the last year, about the importance of adaptability and responsiveness, to be able to act quickly, to respond to individual needs as they occur, and to local needs. And I think above all, one of the things to take from the last year as well and from the pandemic is the importance of collaboration. I think across the piece, in the skills arena, in the employment arena, and more generally, we have seen new partners working together. And we do know that for a resilient skills system, we're going to need strong partnership working going forward, whether that be locally or nationally or sectorally. Okay, thank you.
Thank you very much, Anne, and thanks very much to our panel. So please feel free to put questions into the Q&A bar at the bottom of your screen, but we've already got a couple here. So perhaps we can go with the first one that I've got here, which is to Colin. Are the changes to the business model that you've seen permanent? And what role does technology play?
Thanks, Kirsty, and perhaps my colleagues can help also. I don't want to hog the question. I think there seems to be a lot of complementarity across the presentation, so we can maybe start it as a discussion. Are changes to these business models permanent, and what does it mean in terms of technology? The answer to that is I don't know. In terms of the work that we do with businesses, a lot of the time that the discussions that I have with businesses right now, what they describe is a fundamental business model shift, although remember that our own work is very much focused on workplace practices, and I want to talk about how I think there have been lots of shifts in workplace practices. But I think if you look out the window, you'll see fundamental shifts in business model design and how firms create value, whether it's moving from place-based retail to delivery, whether it's moving services online. There's a question about whether post-vaccine we see a recalibration and a move back to cities. I think most people think there will be some permanent behaviour changes that then drive business model changes. So I think some of these changes will be permanent. And yeah, I've given a couple of examples. I'm actually working on another project at the moment for the EPSRC, which is around servitization strategies in financial services. So as part of what's going on right now in financial services, the idea that financial services companies are asking their employees to really, and seeking to support their employees, really ramp up their agility in terms of delivering a high quality service offer. So the kind of financial companies who had a product and their challenge to their employees was to go sell our product, there's a realization that maybe you can't get away with that anymore, and actually you need to develop a much more sophisticated service offer to your customer base, which was there before, but I think you see increasing energy behind those kind of shifts. So like I say, I think the answer is I don't know. I think there are fundamental shifts in the geography of work and in the assumptions that we make around how consumers are going to behave that probably will see a permanent shift in some business models. More importantly, I think a lot of the work, the conversations we've had, throw up really interesting and fundamental shifts in workplace practices in the kind of three areas that I just spoke about. And I'll be very brief, but if I can highlight a couple that came from PIN research. So Productive Insights Network was good enough to fund a project that we ran last year on underemployment. There was a report on the website, which is a very, I know I was very upbeat in my presentation this morning. If you want to read some very depressing information about underemployment, there's a report that I authored with colleagues on the PIN website. So we were exploring exactly this issue of how business models drive underemployment and poor job quality. But as part of that research, and sadly not reported in the report, but I'll say to PIN colleagues that I'm writing it up right now, and it will be PIN branded in due course. As part of those conversations, we also just ask employers about what's happening in COVID in terms of workplace practices, in terms of how you design work. And we got some really interesting insights on where employers talked about substantial investment in online platforms, and not just online platforms to monitor people's behaviour at home, but to go to Anne's point, to find new ways of working collaboratively, of keeping people healthy, of keeping people linked up while working at home. So we saw big investments there. I'm not saying all employers did this, but we have heard some interesting stories about that. We had lots of stories about really fundamental workplace redesign. So the idea that if your business model is shifting, you have to completely redesign people's job roles and how people interact across teams and the kind of work that people do. And I think, to go back to my HR practice thing, I think the other story that came from those discussions was lots and lots of things that employers thought were really, really important parts of their workplace and HR practice a year ago had suddenly been dispensed with, and really innovative solutions had been arrived at. And a lot of the things that have been dispensed with were the kind of really negative workplace practices that we would often throw up in the lecture. So things like really kind of intrusive performance management, performance monitoring. I know there is an argument that the fact that people have their cameras on all the time might throw up additional performance management interventions. But a lot of the companies we spoke to actually said, I remember interviewing an HR director who said one of the things that's happened in our company is that we used to have quite stringent time-based performance monitoring. And then when everybody took the technology home, we just thought it's too hard, it's too much like hard work, so we just won't bother with it anymore. And we were speaking, this interview was saying, we were speaking in the leadership team the other day, and we thought, why did we ever do that in the first place? So I think there are these kind of interesting, potentially positive shifts in being more creative around workplace redesign, around job design, and around some of the HR practices that businesses use, that I hope there is a fundamental and permanent shift. In terms of whether that's driven by permanent shifts in business models, I don't know, but I think there will be significant changes in how local economies and sectors are calibrated post-COVID.
Okay, thanks, Colin. Anne, do you want to add anything to that?
Yeah, I'll come in there. I agree with a good deal of what Colin said, and the hope, obviously, that from what we've learned, that the good will be taken forward. I mean, I think what has happened is that we've seen suddenly some people working from home, and what did we see? We see that they could be productive, at least in the shorter term. I think as time has gone on, people have sort of craved social interaction. So I think going forward, I mean, it's possible that what we could see is, my own view is that we might see for people who can work remotely, and I think we have to remember here that there's jobs that can't be done remotely, and we shouldn't forget those. But for those that can be done remotely, I think we'll probably see more hybrid working. By that, I mean 2 or 3 days in the office, 2 or 3 days at home. And if you can organise that you can do the things where you want to be concentrating on, we do that in a quiet environment at home. If you've got the space to do that, that can happen. More collaboration going in, more networking going in the conventional workplace. We might see that. I think in terms of, it's possible that what we might see is, as restrictions are lifted, there's some people who think we'll go back to a sort of roaring 20s kind of idea, where people might go kind of slightly mad and, pent up spending. And we all know also what happened after the 20s. You can have severe consequences of that. You can go into more negative outlooks. But I think as well as these issues about the geography of this, I think that's kind of fundamental as well here, because if people are shifting where their place of work is, particularly people who are on higher incomes, that has implications for the broader local business ecosystem in places. So I think that there's a lot here that stems beyond what employers are doing to what the interaction of businesses, particularly in city centres, what's going to happen there. There is an issue that if people are going into city centres to network, that might kind of drive some of the hospitality industry. But I think we also have to, so I do think, as well as looking at the the business models of individual employers, we have to think what that means for local ecosystems in place and what that means more broadly as well. So, as I say, taking from what Colin said, I think we have learned a lot, and hopefully the good sides of that will be taken forward.
Can I just add very briefly, I completely agree with Anne's broader spatial point. Again, to try and look at it in terms of an opportunity. Many years ago, Anne and I both worked on issues around why there are high levels of disability claiming in certain regional and local labour markets. So the question might be, why are there so many people on disability benefits in a city like Glasgow? And part of that answer, along with lots of other components of the answer, is to do with the dominant business models and sectoral configuration in a city like Glasgow. And I suppose my argument would have been back then that if you look at a city like Glasgow, or Sheffield perhaps for that matter, where much of the work is time and place specific service work in sectors like retail, that is also quite insecure, that is also quite low paid, where there's a lot of flexibility on the side of the employer, and in fairness, where the service model means that you have a lot of hours to fill. Our argument back then and back there was, for vulnerable groups in the labour market, that's a particularly difficult set of business models to interact with. If you're trying to manage a health condition or a disability, standing up for 8 hours a day in John Lewis is not a particularly attractive employment offer, and like I say, fold in the kind of insecurity around that as well. That isn't to say that I have any particular optimism that the city of Glasgow or any other cities are going to have some brave new world of a magnificent new economy. All I'm saying is some of the business models at a local economy level, which really constrained the opportunities of vulnerable groups, like people with caring responsibilities, like people with disabilities, are under severe pressure, which is why I come back to, we need a policy and business stakeholder focused discussion about how we can use the opportunity, if that's not too base a phrase, use the crisis to try and build back better.
Thanks very much. I'm mindful we've got 3 minutes left, so I'm going to do an attempt or big question and ask for a minute response, if that's okay. I think what you've all highlighted is that I loved Anne's concept of this has been a stress test of the system, and the point that has been raised in the Q&A here about we have exposed levels of inequality in work and employment, breathtaking extent, people who can't work from home, people who are feeling that they're forced to go into work because of our inadequate sickness health policies, a whole host of essential workers who are on precarious contracts. And then at the other side, we hear, and I'm into it as well, that job quality is the answer. So we know that employers at the best of time haven't necessarily invested in job quality. Why would we where we are? So given that employers are not investing in this at the best of times, at the worst of times, potentially where we are now with exposure of inequality, what should policymakers do? What can we do to try and correct some of these cleavages that have emerged and really focus on the productivity outcomes? So I'm going to start with Daniel. You've got a minute, Daniel.
Okay, well, very briefly, if the policy response is ineffective, what will happen is that you'll exacerbate these inequalities, and they'll be built in for a far longer term. So it's essential that the policy response is effective, and that will involve many of the things that I spoke about, but linking those up. So how do issues about skills relate to the safety net that's employed? So can there be a conditional furlough scheme? It's conditional on there being some employment training, some skills training that may manage transitions that are changing the structures of regional economies. And by doing that now, because the awareness is there now, there could be great benefits. So it's linking up the policies to address all these points.
Right, thanks, Daniel. Colin, you've got 10 seconds.
We do have to grapple with the idea that there may have to be a regulatory response at some point. As you say, poor job quality, low quality business models, underemployment has been baked into a lot of business models and sectors. I don't think we're likely to see a regulatory response from the current administration. So what else can we do? I think the public sphere can be helpful. Public sector employers, or a chunk of the labour market, they can demonstrate their commitment to fair work and job quality. And through procurement, within procurement rules, we can try to highlight the value of good job quality, of workplace innovation and of fair work. And the last thing I would say is I think research does have a role to play here. Of course, as I was saying, you read the chapter, we are very clear that business models matter, and they do severely constrain room for manoeuvre and the logic of how organisations make decisions. As I was saying, within business model, within sectors of the economy, there is substantial variation, which is why I spend my whole working day, when I'm not doing nice things like this, engaging with employers, trying to demonstrate the evidence that job quality is an investment that can actually have a return for employers in terms of enhanced productivity and innovation, as well as well-being benefits for employees.
Okay, thank you. Anne, over to you.
Just to say very briefly, I would agree with what's been said. I particularly think that what we've learned from this and can take forward is thinking about the need for a holistic approach and how things are very much linked together across different policy domains. And I think the other thing that we have learned, and I think has been brought up the agenda that is a positive thing, is that it's been brought to light how some roles are extremely important to everybody's well-being, and we haven't valued them in the past. And I think, at least the awareness of that has risen up the agenda, and I think this is the opportunity to take, and it has to be a holistic response.
Thank you very much. Thank you very much, all our panel, for your very valuable contributions this morning. Thanks very much for everybody to attend. I think we've got a slide of the next seminar, which is next week. Perhaps we haven't. They're all on the website. Oh, Kat, you're brilliant. There we go. The next seminar next week is on enterprise and entrepreneurship. You are all very, very welcome, of course. But thanks very much for coming. Thanks very much to our speakers, and hopefully you'll be able to join us for the next webinar. Have a good day, everybody. Thank you.